Cardiac arrest can affect anyone at any time.
Do you remember the Danish footballer who was playing in a match against Finland in this year's Euros? He collapsed in the middle of a game. He was lucky that his teammates were there and they performed CPR on him, and an AED was also used. These fast actions ensured his chance of survival were greatly increased, and pleased to say he is making a full recovery. Let's have a look at how and why CPR and the use of an AED are so important.
CPR and AED shocks given within the first 4 minutes are crucial to enable survival. So what is an AED? AED stands for Automated External Defibrillator. Defibrillators are the brightly coloured boxes that you might have seen in supermarkets, tube stations, railway stations, bus stations, airports, some telephone boxes in rural areas, and also high traffic areas and public places. Have a look where your nearest one is. So firstly, activate the machine, turn it on. Machines vary, but this is usually done by opening the lid or pressing an obvious on and off button, but you want to turn it on. You will need to remove the patient's clothing. So you need to be able to cut the t-shirt, the jumper off using a pair of scissors, which is normally inside an AED. There's normally like a little accessory kit to remove the clothing. Sometimes you might need to shave the chest as well. So you might need to dry the chest, use a razor to shave it, because the pads need to stick to naked skin. Peel the pads off one at a time and place them onto a dried chest according to the diagram on the packet or on the video of the AED. Normally one pad is placed below the casualty's right collarbone and position the other on the casualty's left hand side over their lower ribs. The AED will then begin to analyse the heart rhythm. Stop CPR when instructed to do so by the AED. It will say, do not touch the patient. Ensure no one is touching that casualty. If a shock is advised, then check the whole length of the casualty to make sure no one is touching that casualty before you push the button. Sometimes the AED will automatically shock, but make sure you shout, clear, stand clear. A bit like you see on the films. So you might need to press that flashing shock button, or as I said, it might do it automatically for you. But make sure no one is touching until that shock has been given. When the shock's been given, you continue with CPR as directed by the machine, and you keep going with 30 compressions to 2 rescue breaths. You do not stop to check them unless they begin to regain consciousness or they show signs of life such as vomiting. The machine will reassess the heart rhythm normally every 2 minutes, and they'll advise another shock if indicated, or they might say no shock advised. Please, if it says no shock advised, just continue with CPR and follow the prompts. Keep going until help arrives. And only stop CPR if the casualty begins to regain consciousness or until you become too tired, you can't carry on and there's no one else there to take over from you. If there is someone else that can take over from you, make sure you keep swapping. Now don't forget to look at our video about giving CPR during this current pandemic, because rescue breaths are not currently advised. But it depends on the possibility of COVID-19, also your close contact with them as well. So I'll leave the link below so you can check out that video, and also the advice of the Resuscitation Council in the UK. Hi there, my name's Emily. Don't forget to hit subscribe and the notification bell so you don't miss out on any of our videos.